You're getting dressed or taking a shower, and you feel it, a lump under your skin. A quick search usually suggests two harmless possibilities, a lipoma or a sebaceous cyst. But there is a third, rarer possibility, a malignant tumor that appears identical to the others during a physical exam, yet carries a high mortality rate if left unaddressed. The most likely candidate is the lipoma. Roughly 2% of adults will develop at least one. It's a benign growth composed of mature white fat cells, typically situated in the soft tissue layer between your skin and the underlying muscle. A lipoma is defined by its fibrous capsule. This membrane keeps the fat cells contained and prevents them from attaching to surrounding structures. Because of this, pressing on the edge of the mass causes the entire lump to slide cleanly away under your fingers, a physical characteristic doctors call the slippage sign. While a lipoma is technically a tumor, it lacks the biological capacity to invade nearby organs or metastasize. In medical terms, tumor simply refers to an abnormal mass of tissue, and in this case, the growth is entirely localized. This isolated, encapsulated architecture is the primary reason lipomas feel the way they do. This structure creates a predictable physical baseline for what a harmless fatty growth should feel like during an exam. The second common possibility is the sebaceous cyst. Despite the similar outward appearance, its internal composition is unrelated to fat. A cyst is a sac filled with keratin, a semi-solid protein paste formed from accumulated skin cells. We've previously detailed the mechanics of these growths, but effectively, a cyst functions like a blocked drainage pipe. The lining of the sac continuously generates keratin, which has no exit point, causing the mass to gradually expand and stretch the overlying skin. Because it originates from a blocked pore, a cyst often maintains a physical link to the surface. If you see a small, dark opening at the center of the lump, known as a punctum, it is a cyst. Lipomas are entirely subcutaneous and never have this surface connection. This connection to the environment is significant. While a lipoma is sealed away, a cyst's opening allows bacteria to enter the sac. This often leads to inflammation, leads to infection, and a foul odor as the keratin breaks down, none of which occur with a lipoma. If no punctum is visible, the primary distinction is texture. A lipoma is doughy and soft, providing the same resistance as room temperature butter. A cyst is firmer and more spherical, feeling more like a grape or a rubber ball lodged under the skin. Movement is another differentiator. A lipoma's capsule allows it to glide with almost no resistance. A cyst might shift, but it usually feels tethered to the dermal layers above it. History also provides evidence. If the lump has ever leaked a cheesy material or produced an odor, it is a cyst. Lipomas are solid masses of fat cells that cannot discharge or drain. Even with these physical signs, doctors recognize that touch has its limits. Manual palpation cannot reveal the specific cellular structure of a mass, which is why imaging like ultrasound or MRI is used to confirm what is happening beneath the skin. These tactile differences help distinguish a cyst from a lipoma, but they are insufficient for identifying the rare malignancy that shares the same physical characteristics as a benign fatty growth. This is liposarcoma. It is a malignant cancer of the fat cells that, in its early stages, presents as a soft, painless lump. Unlike the encapsulated lipoma, a liposarcoma develops invasive borders that grow into the underlying muscle and fascia. Because this cancer mirrors the physical traits of a benign growth, it is often dismissed by patients. This delay in diagnosis allows the tumor to grow larger and become more difficult to treat, which is the leading factor in liposarcoma fatalities. Certain growth patterns indicate a high risk of malignancy. The most significant is rapid expansion. A benign lipoma typically remains stable or grows very slowly over years. If a lump doubles in size over a few weeks or months, it requires an urgent biopsy. Size and mobility are the next key indicators. Any fatty mass exceeding 5 centimeters, roughly golf ball size, is statistically more likely to be a sarcoma. Furthermore, if the lump feels fixed or anchored rather than sliding freely, it suggests the mass has invaded deeper tissue. Location also matters. Lumps situated deep within the muscle or the abdomen are more concerning than those just below the skin. Finally, any mass that causes progressive pain or neurological symptoms like tingling should be treated as a priority. Statistically, the vast majority of fatty lumps are harmless. There are only about 1,700 cases of liposarcoma diagnosed in the U.S. annually, compared to millions of benign lipomas. It is also worth noting that a benign lipoma does not transform into a liposarcoma. They are biologically distinct from the start. A lump you've had for a decade won't turn into cancer. The danger lies in misidentifying a new malignancy as a harmless growth. Identifying these specific structural anomalies, like rapid speed of growth, unusual physical size, and deep anatomical depth, is the only reliable way to distinguish a life-threatening malignancy from its benign counterparts. Surgical removal highlights structural differences. Because a lipoma is encapsulated, it often pops out of the incision in one piece once the surgeon applies pressure. A cyst requires more precise dissection to ensure the entire sac is removed. If any of the wall remains, the cyst will eventually return. If you are assessing a lump at home, start by looking for a surface punctum and testing the texture. A firm mass with a visible pore is likely a cyst, while a soft, doughy mass is characteristic of a lipoma. Next, check for the slippage sign and review the history of the mass. A lump that has remained the same size for years and slides freely under your fingers is a low-risk finding. This assessment helps organize your observations for a medical professional. However, these physical traits provide probability, not certainty. Only a formal imaging study or a biopsy can provide a definitive diagnosis. There is a common misconception that if a lump is painless, it must be benign. In reality, early-stage liposarcomas are frequently asymptomatic. The absence of pain is not a reliable indicator of safety. You should also avoid attempting to squeeze a suspected lipoma. Because the mass is composed of solid fat tissue, pressure will not drain it. It will only damage the surrounding tissue and cause internal bruising. To illustrate how large these benign growths can become, medical history includes a 50-pound lipoma successfully removed in 1894. While it was enormous, it remained entirely non-cancerous and was contained within its own capsule. Most subcutaneous lumps require no intervention. However, if a mass is deep, fixed in place, or grows rapidly, skip the self-check and request an immediate imaging study from your doctor.